This is Dr. Sunstein and of NSPC Brain and Spine Surgery, and welcome to our podcast. I am here with my fellow spine bro.
I'm Dr. Rich Obedian of Island Spine and Sports in Hicksville.
All right, we have a special guest today.
Very special.
We have a special guest. We have Phil here, one of our patients, and
Phil Yofi.
Phil Yofi, yes, that's correct.
Well, I wasn't going to give him the last name. Not necessarily that they like to maybe reveal that, but that's okay. We're very happy to have you here.
I'm fine with that. Thank you.
Phil Yofi's Russian.
Phil Yofi is Russian, and we were talking about the fact that we have some Russian doctors in our group. So I'm used to kind of dealing with Russian people. And
You're used to the Russian mentality?
I have. The Russian mentality is very strong.
Is it much different than the American mentality, do you think?
They're very, very, they don't, one thing about the Russians.
They're tough.
They're tough and they don't complain very much. And they're
strong.
Very strong. They're very smart.
Educated.
They're tricky. You got to be on your toes with them. And sometimes they're loud.
They can be.
They can be very loud.
And maybe in your practice.
Especially after a few bourbons or drinks.
If they become neurosurgeons, they become loud.
So
argumentative.
Phil was a patient that we had both seen in the office who had originally came in with a history of back pain and leg pain. I think your leg pain was such that it was down to your ankle.
It was going there, yeah.
Well, let's hear from Phil.
And
tell us your story.
Well, I was going to just mention the fact that he was in our office with these complaints.
Yes.
And
yeah.
So we're bringing to see Dr. Sonstein and myself.
So basically, the worst case was already the leg pain and by the spine, the left side, and it was starting to get worse and worse. So I started first feeling these effects in April of this year. And I have a long history, like you guys already know, from working out with improper form. So little by little, over the years, I'd say over 10 years, I would get like an episode after the gym, it would hurt, and then it would usually go away.
And it was just back pain?
What do you mean improper form exactly?
So like lifting, like a deadlift, I'd do a little bit, like ego lift, do a little too much with not the right form. My core would be a little bit out of place, and I would feel it right away. It's like a sharp.
It's important to keep your back straight.
Absolutely, yeah. Had I known that, hindsight, yeah, I would have done it differently.
Yeah, I always caution patients with back problems to avoid overhead lifts.
You don't want to do.
It puts a lot of pressure on you. It puts
Absolutely,
a lot of pressure. Yeah. It increases the valsalva, increases the stress on the discs in your back,
right?
And it can lead to a herniated disc. But probably what you were experiencing when you had those episodes of lower back pain and not the leg pain. Mm-hmm. Was probably more. It could have been more muscular. It could have been a little bit discogenic, but probably more likely, especially when you're young, it's probably more likely to be muscular. And what's worrisome is when it starts shooting down your leg.
I think something was brewing.
Something definitely. It was a combination of things happening. So in April, I'm used to letting it go for a month and then it'd get better. In April, it started hurting, right, and then it continued for a month. And I was telling myself maybe I'll wait another month. I'd see some improvement, but then it started to travel a little bit. I couldn't bend over. I noticed when I'd be brushing my teeth or I'd sneeze, I start to feel pain in the lower back. And
flexion.
Then, and around.
And what was worse, the leg pain or the back pain?
I want to say it started off with the lower back pain by the left of the tailbone.
Was initially worse. Right,
and then it started going into the leg. It started going slowly into the back of the thigh, and slowly into the Achilles, where it was getting really bad movement. Basically.
Yeah, that's a particular distribution of the nerve.
Right.
You ever trouble walking?
Not too much, but I started dragging my feet towards August. Yeah, that's when I had to go to the ER. Around then, so in the span from April to around August, that's when it really I noticed it was.
You were being treated. You were having some treatment in that interval. Between when you had seen us and had eventually gone to the.
He had traveled. He had even been to Russia.
I've been to Russia, so that's what activated probably.
Where were you in Russia?
In St. Petersburg.
When were you there?
This was June, beginning of 4th of July weekend. I came back. I came back July 3rd.
You were there for pleasure or for business?
To see family.
To see family.
I have all my family there. My uncle specifically.
You were born in St. Petersburg?
I was born in St. Petersburg, and we moved when I was 9 months with my family.
I really want to go there.
It's nice. It's pretty.
And how did you get there? I mean,
it's hard to get there though.
What was your travel?
To go to Russia now? You mean?
Well, no, right. How did you get
July?
there?
So yeah, in June, July, it was hard to get there. We had to fly to Warsaw, to Poland, and then take a small plane to Estonia.
Because you're a U.S. citizen?
I am a U.S. citizen.
You're,
Yeah.
so you're no longer you don't have to carry a Russian passport.
No, we had to, or my folks had to give that up when they traveled to the U.S. when they immigrated to
When
the
they
U.S.
immigrated.
Yeah.
Got it.
Was it like a small little, like, was it a jet or was it like a propeller plane to go to Estonia?
It was a jet plane. It was
A
a
jet
smaller
plane.
one. Yeah, I think the seating was 2x2.
Okay, so it was a smaller,
it was a
but it was
small
a
one.
jet.
Yeah, it was a
And you
jet.
jetted to Estonia, which must be not that far a flight from Warsaw.
I'd say 45 minutes. As soon as you go up, you start going down already for descent.
Right.
Wow. And how far is Estonia from St. Peter? That's another flight?
It's you have to take a car. You have to physically cross by foot, and customs are hilarious on the border.
It's like an adventure.
It was. Yeah, they
You have to
did
cross
it.
by foot? What about driving?
So we drove to the border, but you have to, I guess,
get out of the
you have
car
to
and
get out of
they
the
can
car and
inspect
travel.
you.
Yeah, you got to.
And then what happens after they inspect you and they say you're clear to go?
That's it. Then there's another car waiting for us. So you call a company basically beforehand, and
Oh, so you have
it's
to
like a
give
taxi.
up the car right there?
We didn't rent the car. It's like a company that takes you to
Travels
the
you, yeah.
Oh,
from
okay.
Estonia airport to the border, and then from the border, it's another driver to St.
So
Petersburg.
the driver picked you up.
Right. Yeah.
You had a driver.
Yeah. So it was
Not renting a car
no,
in
no,
Russia.
no. It was 3
It's a
hours
little
to get
complicated.
there. Yeah.
International travel.
Wow.
Europe.
And you had it all arranged for, and it was all set up, and so you could actually, you were picked
Do
up.
you need
Yeah.
a visa to go to
You
Russia?
did need a visa.
You need a
Yeah.
visa.
We need a visa. Pretty straightforward. I think it was 3-year visa we did.
I see.
So we have family there, so it's not that big of an issue. They do some checks on you, and then they interrogate you, and then it's fine.
What do they ask you?
What is like, yeah, what was we're curious. This is like
they're funny.
interesting.
They're like
It's international intrigue.
so you wait for like 2 hours, and then finally, my dad went through, but it's me and my mom. They interrogated. They call you in, and then very friendly guys. It's like a younger than me, a guy in plain clothes, and he's saying basically he has my passports, he has my info, and he's saying, "How's our friend doing, Mr. President? What brings you
Trump?
here?" Yep. And then he asked me to unlock the phone. He plugged something in, and he's just asking me simple questions.
He
Where
was
he was
checking
going.
your phone?
Yeah, they check your phone.
What are they checking for? Like social media or
I believe so. Yeah.
interesting. Wow.
They
To
throw
see
in
if you're like
something.
could be a problem.
Listen,
person.
To see if you have the U.S. if you're a CIA agent.
exactly,
you're a
yeah.
spy.
So I'm like I speak Russian, so they're probably
You're a-
thinking,
yeah,
yeah,
you're
U.S. passport.
You're a risk.
Yeah. So, but they were fine. They were friendly. They asked questions, and then they
Did they ask you about religion or anything like that?
No, more politics, and
More
they were.
politics.
Did they ask if you're a Democrat or Republican?
They
Or a
didn't.
Trump supporter?
Yeah, they didn't ask it like that,
so,
but
so obvious, but they made it seem like
but they were kinda-
they were very
you know.
Trump friendly. It seems.
definitely, yeah, they're definitely
They
Trump
like
friendly.
Trump.
Yeah. And this was during I believe,
Ukraine
the
war.
fires. Yeah, or there were some kind of riots, I believe, in
There were riots in
L.A. was it, or something like that?
there was a lot of Palestinian riots going on
Also,
in California and all over the country.
yeah, I believe so. It was during
I
that
don't,
time.
I don't
Israel.
recall like Russian riots.
It wasn't Russia.
No,
No,
they weren't.
and I'm like a protest of the Ukrainian riots.
No, it was the Palestinian.
I believe
that's
so.
that's
yeah.
sort of overshadowed everything. But anyway, you got there and they let you through.
Yeah, but during that flight, like 30 hours in transit, the whole thing, my back was really, really going.
Were you having leg pain then too?
Yeah, definitely. I was getting leg pain. It was getting worse. It was getting worse.
So you finally made it to your uncle's place, and now you're miserable with severe leg pain.
Yep.
It's getting weaker and number. And
What did you do? Did you get
he
get
takes
help
you,
in
he
Russia?
takes you to a pain specialist there.
Pretty much, yeah. So we arrived like at 1 a.m. and then I woke up. I slept on the sofa. I woke up broken, and then he said, "Let me take you to a place that my cousin was saying they're gonna make you feel like new. It's like a massage guy." And I had the MRI previously of my back, and when I showed it to the guy, he goes, "Oh, no, I'm not gonna touch that. You actually need to see a specialist
You
for
need a
that."
doctor.
Yeah, and then I
That
went
made
to
good sense.
I went to an institute, neurology institute. It's a pretty big one. I forgot the name.
Okay.
St. Petersburg, and they took me in, and then they looked at it, and they basically said, "You need a operation."
Was it the Burdenko Institute?
I
I
don't
heard
remember.
of that one.
Yeah,
But
Yeah.
well, actually, my chairman had worked there.
Okay, interesting. He was Russian.
No, but he got experience putting catheters in people with at that institute.
Interesting.
But the place seemed like it was up and legitimate and
yeah, it's
totally.
definitely yeah. It's
yeah.
like a institute.
Quality.
So
I mean, look, they have problems like this
So they
in Russia
wheeled,
too.
so they wheeled you into an operating room and they did an epidural steroid injection.
This was before that. I went to like I finally went to the institute afterwards. That's like my final I guess analysis of what's going on. But the day after I arrived, I did go to like this I guess, emergency clinic, and I showed them the MRI also, and they said, "Have you done epidurals?" I said no, and they did an epidural without any X-rays.
Just did it right there in the clinic.
Yeah, and it didn't. I got some relief, but it might have been also from the IVs. They do IVs for everything there.
They gave you like an IV Decadron, like maybe some IV steroid or something.
Exactly, yes. For five sessions, I had to do it. I had to go with that the tablets and the medication. I had to go to another doctor because we were staying in the countryside.
It's so sad. You have to they make all this effort to get there, and then you have to deal with this. You know?
That's
What do
we're
you think of
saying.
blind epidural?
I think that's the way they used to do it.
I think in America that's not done.
Yeah.
It's not done. It's not done anymore.
It's not done anymore because I think Medicare now will not pay for an epidural
Well,
if it's
that might
not
be
done under
right.
fluoroscopy. So it's always done. And I remember, there's a tradition now for pain specialists to do up to 3 epidurals in a 6-month period.
Right.
And I remember asking about 20 years ago, I went to a conference and I asked a pain doctor, where did this come from, this 3 epidural number? And he said, you want to know the truth? I said, yeah, what's the truth? He said, the truth is we say 3 epidurals because when we first started doing epidurals in the 70s, we thought we were in the correct epidural space 1 out of every 3 times because we didn't do it under fluoroscopy. So therefore, we figured, yeah, you get 3 shots at doing it, and you get it in the right spot once, then you'll be okay.
Yeah.
That's how it all started.
That's
not because
that was his opinion.
It's not because of the limited amount of cortisone you can get in 1 year to cause osteoporosis or anything.
Right.
Like that.
I don't think there's any mathematics to prove that, but I mean, sure, that's another concern is that the side effects of these. The other thing is if they're not working, if you get 3 and they're not working, what are you doing?
Yeah.
Well, I mean, I think even 2 you're not working. It's probably not to get the third.
Especially
one.
if you have a massive disc like this and you start going for multiple epidurals, I think that's that's a definition of crazy, doing the same thing over and over again, expecting a different result. It's not going to happen with this is the axial MRI, and it shows a massive herniated disc on the left side. You want to talk about it, Bill?
Well, sure, absolutely. But even before we even talk about it, I wanted to ask you. You had your epidural injections in Russia, and you felt you got some relief, but not complete
Not
relief.
complete, definitely, yeah, not complete.
better than where you were.
How long
Yeah.
were you in Russia at that point? How long did you spend
This
there?
would be, so they gave me a 5-day course, so this was the second day. I was there for 10 days about, so
10 days.
yeah.
And then you left and you went back the same way?
A little bit easier because we broke up our trip in Estonia. We spent the night, and we should have done that in the beginning, in hindsight, because the travel was like cut short.
I was supposed to go to St. Petersburg before the war started with Ukraine.
I remember that. I remember that.
Unfortunately, I canceled because of the war in Ukraine. But it's supposed to be an amazing city. The Hermitage is there, and there's a lot to see.
Right.
A lot of
It's
history.
definitely on my list of things to do.
And
They had changed the name to Stalingrad, I think, right? And then
it was Leningrad.
Leningrad,
Leningrad.
and then it became back
Well,
to
I'm
St.
sure
Petersburg.
I'm sure you'll end up going there before me, and then I'll follow in your footsteps like I do.
Well, I think the war has to be solved first before
Absolutely.
before people like us, average tourists, go back.
Did you find that there was? I mean, would you feel like there was, war
Or 10.
feeling?
It's not really. They in
It
the
was like
city at
normal
least. Yeah, it's normal life. They do have ads. They have ads like billboards. Join the army and you get like millions of rubles.
And get killed?
Yeah, that's what it is.
So millions of rubles means what in American money?
It might.
Like how many
forgot.
rubles to $1?
I forgot what it is. I don't want to lie and tell you, but it's like
It's like thousands of dollars.
maybe it'd be like 30,000 or something like that, but something along those lines. Maybe less. Don't quote me. But
Isn't it funny how it's rubles in Russia, but it's rupees in India?
in India, yep. For the longest time, I used to say rupees,
Yeah.
thinking it's the gem.
Well, anyway, continue on with your story. It's fascinating.
So right after the epidural and the IVs, we traveled back to the U.S. and this was around July 4th. It was okay, but I still had that pain, and it just got progressively worse. As I couldn't, like I said, I was sneezing. There was like a shooting pain.
Every time you'd sneeze, it
Yeah.
increase your intra-abdominal pressure, basically.
Yeah, and then bending over to brush my teeth, I couldn't do it. I had to put my knees to the side to kind of kneel. I couldn't even pick up my daughter anymore at this point.
It's hard to function.
Yeah,
This was
it was.
before you had seen us in the office?
This was,
'Cause I
I want to say,
I'm trying to think if I saw you
around
before.
that time. No, after I came back, I scheduled to see you guys.
You sold out. Your primary had sent you
Yeah,
to
I
me.
saw exactly. Yeah,
And-
I got a
and-
recommendation or referral.
Yes.
Then I saw you at the office, and then you told me about Dr. Abid
Right.
and your team.
Because we're a team. So
Your team, by the way, is amazing.
thank you.
Shout out to Lauren and Dominic. They're great.
We love
Yeah.
doing what we
Yeah,
do.
we
We've been working
appreciate
on
that. They appreciate that.
25 years. We've been working together. It's a long time to be with this
Yeah.
guy. You know, and he's sure he feels the same thing about me.
No, it's like a marriage.
Yeah.
So you had this MRI. So let's talk about the MRI you had done. So you're here having these symptoms that they're on the left side, going down to your Achilles. Why is it down to the Achilles? Because the nerve that goes down to the Achilles is the nerve that's being affected by your disc. So you have.
So this is the L5S1 level.
This is the. So this is the side view here. So just a reminder that there's no spinal cord at this level. The spinal cord ends up at L1, which you can't see on the slice because it's just a little bit off
to the side, a little bit to the left side.
But
see the disc better.
The disc space itself is a bit collapsed compared to the other spaces above. You can see. So,
well, although it's not at this level of the spinal cord, it's still at a very important level because the nerves that go to the bowel and the bladder are there as well. That's called the cauda equina.
right, and it's taking up a good portion of the.
That's actually what led me to the
the
ER.
actual.
And that's what
canal.
he ended up starting to get some urinary symptoms.
That disc is grayish, which indicates that it's a softer type of disc because it's got some fluid in it, which basically means it's sort of a fragment of the disc is like a jelly donut. Then that's the jelly that has come out, and that is causing compression of the descending nerve root, which is the S1 nerve root.
This is the hernia,
which goes to the Achilles and the calf, and supplies your ability to push your foot down like to push on a foot on a pedal.
Right, and this is the canal, the cauda equina area. This is the nerve root. On the right side, it's wide open. The left side, you don't even see it. It's obliterated.
Part of it could be also affecting the L5 nerve root, but I think it was mostly an S1 type syndrome, which is.
But if you look carefully at that sagittal cut, you can see he has a little bit of a bulge at L4-5.
Right, and we don't have the axial to show, but he also had a bulge, and
it was worse on the left side. It was eccentric to the left.
So we felt that there was obviously something that was causing an effect on the left at L4-5 too, but the main event was the L5S1 disc herniation.
So you actually ended up going to the emergency room.
I did, yeah.
Because of the urinary symptoms.
Yeah, I said that was the last straw already.
Yeah, and that's a significant problem. That's consistent with a early cauda equina syndrome where you have crushing of the nerves that go to not just to the leg but also to the bladder. And that's a surgical.
That's what you were experiencing. You were experiencing some urinary symptoms.
That's what led me to go. Yeah, because
you were having urinary retention.
It was just after the trip, it was getting worse and worse and worse. Yeah.
Yeah. So everybody talks about incontinence, but really the incontinence is an overflow incontinence.
Mm-hmm.
They have retention. They can excrete the urine as well, and then you get overflow incontinence. But the first symptom is really the retention, the urinary retention. So that's what he's experiencing.
I also thought maybe it would be because of the meds. I was on gabapentin at the time.
Some of these meds can affect the ability to urinate. I mean,
narcotics can definitely do that.
Can definitely cause essentially everything to slow down.
But it definitely got worse. Yeah.
So you had
he came to the ER at NYU at Winthrop,
and we took him to the OR.
We took him to the OR very quickly. Given his urinary symptoms.
We did a laminectomy. I think we did a laminectomy going from L4 to S1 because we wanted to make sure that the nerve from that disc above was also decompressed.
Right. So we wanted to make sure the L5 and the S1 nerve roots were completely decompressed on the left side.
And we did that, and we took a good amount of the joint to really fully decompress you, and we ended up adding a little bone dust on the side to give you more stability over time.
That was interesting, when you told me about that.
Yeah, it's called an in situ fusion.
But that's really, I mean, that is if you're having a steak dinner, that's a side compared to the steak, which is the main event, which is getting rid of that disc herniation, which was underneath the ligament that holds everything in place, but it was pushing from underneath from the front and crushing the nerve. And therefore we had to do the surgery, you have to find the nerve. That's very important, and separate the disc from the actual nerve itself, because you want to make sure you're free and, from any, what we call adhesions. And we took out the disc.
It was a very satisfying disc to take out.
You had a big chunk of disc.
It was
took out.
Massive disc, huge.
We love taking out the disc. When we remove the disc, we hold it up and say, "Hey, this is the problem."
Yes.
Might this be the problem?
Might this be the problem?
Yes. And Yeah, it's a very satisfying thing as a spine surgeon to take because you know immediately you got the pain generator.
Yeah.
And that patient's going to feel dramatic relief and generally very quickly.
We did a full laminectomy too, I think,
I think so.
because of the
Because of the
canal.
size. Yeah.
But we emphasized more on the left side. People always ask me, what's the difference between a laminotomy, laminectomy, discectomy? It's the same thing, basically. We're removing some bone to get a window to get in there to do what we need to do. That's really what it is.
It's the degree of how much bone that you remove.
Yeah.
How much of the lamina you remove.
And how much of the bone did I lose?
You lost some of the
Some of it.
bone that basically is the back wall of the canal,
Okay.
which you don't really need to survive, like an appendix.
Right.
You have all those tissues above it, which protect you anyway, and you have gaps to start out with in the spine anyway. So people always are like, aren't you going to put it back? You just can't put it back.
That was my first thing, actually. I was thinking, what's the least invasive way to do this?
We did it pretty minimally invasively comparatively to what, it was in the old days where they used to make a much bigger incision, but we try to make a small incision as we can do, but you have to see what you're doing.
Yeah, you have the visualization is key.
Yeah.
When I was a fellow, there were two surgeons at HSS. One would make a small incision, one would make a larger incision. And this one who made the small incision would say, well, my patients do better post-operatively because they don't have as much scar tissue. It's a smaller incision. They can go home the following day. And I asked the one who made the bigger incision, how do you feel about that? He goes, that's complete nonsense because they're not going to feel that much pain. It's like 4 or 5 inches versus 1 or 2 inches. It's not that different. And if you don't see, like Dr. Sonstein said, if you don't visualize that nerve, your chance of a nerve injury is exponentially higher. And that's the one thing you want to avoid.
They did a study on this actually in the New England Journal comparatively to the traditional open versus MIS, which is minimally invasive type. And actually the results favored the open procedure.
Yeah, it's like carpal tunnel surgery. There's open carpal tunnel where you make a 2-inch incision, and there's endoscopic carpal tunnel. And when I was in training, there was a whole debate, which is better. And the bottom line is, sometimes there are aberrant nerves that you can't see in a minimally invasive technique, and you can get a nerve injury. So if I always wonder what would I do. I always think what would I do if it was me or my family on that operating room table. And you really want your surgeon to have good visualization to see exactly what the problem is and get to it and repair it.
Some of these people,
Absolutely,
some of these surgeons are getting very slick now with their retractors and things like that to be able to get in there. But there's really no substitute to seeing that nerve and seeing that disc because you don't want to miss a fragment. You want to make sure you get all the fragment out.
Makes sense, yeah.
Because people they'll go after the surgery and they'll be like, I'm still in pain. And they have a retained fragment of and you don't want to have to go back and somebody if you can avoid it. I tell you that much.
Yeah, because when you go back, there's more scar tissue, there's more chance of infection, there's more chance of spinal fluid leak, there's more chance of complications. So remember back in like 20 years ago when we were first working together, we used to do these discectomies through a tube.
Yeah, we used to do the micro discectomies with the they're called MEDs. You're right. We used to do that. And a lot of doctors still do that kind of stuff. But it just never was as satisfying. And as far as I'm concerned, this is the way to go.
I think it's safer.
So how did you feel after the surgery? You had the surgery.
So the first, I'd say week, the scar tissue was healing. So like you guys said, you cut my back. So I think the movement.
Your back was a little sore?
Yeah, it was confusing me. But
how about your leg?
The leg
right away. The pain down the leg was gone.
You knew there was something better.
Yes.
It was a better situation.
And you went home the following day, I think.
I think they admitted me, was it Thursday? And I went home, I want to say Sunday.
Sunday?
Yeah, I think I spent a night or two.
Yeah, okay, that's fine.
Yeah.
We never have a problem with that. I mean, patients are always thinking they have to go home that day or whatever. To me, it's when they're ready to go home. And if the hospital, they don't kick them out, the reason
it isn't like we had a C-section or a baby and you got to go home like 2 days later.
Yeah.
Most are able to go home the next day, but sometimes people need an extra day, to get some more physical therapy, because the hospital has physical therapy and helps them really get back on your feet.
Yeah, they did that with me. I remember it was a trip to try to walk again, like small little steps.
It's a weird feeling.
You have to relearn how to basically walk again.
Yeah. But the rehab at NYU Winthrop is really excellent. The physical therapists there are really top notch. They get you up the day of the operation.
They should really give us more block time for the amount of times we've touted NYU Blanco and Long Island. I tell you, if anybody's listening, we really have been promoting that
It's a
hospital
plea for more
system.
block time.
Yeah.
Yes.
Um, but so you were happy with the hospital stay,
I was, yeah.
and then you went home. Probably had some pain medicine for the incision in the back.
Yeah, I had pain meds. I forgot what they prescribed.
Usually like a Vicodin or Percocet, something
I believe
oxycodone.
so, Oxy, and
Yeah.
then I had the gabapentin and I guess some other
Muscle
Like a
relaxer.
muscle relaxant. Yeah, there
Yeah,
you go.
generally we try to wean you off the gabapentin and the muscle relaxer and even the narcotics as
Yeah.
quickly as possible because they can be addictive and
Absolutely, yeah.
they can affect you in other ways that we would like to avoid. The point of the operation is to get you off these medications.
The meds, yeah. And I thought fairly well. You guys did fairly well because I got off of the tablets. I think I still had leftovers within like I'd say 2 weeks.
You had your surgery in sometime in August, correct?
Right.
So right now it's been getting towards 3
We're
months.
almost
3 months, yeah.
Halloween, so we're
Getting
over
towards
2 months.
Well, let's see, the September, October, yeah. So
2 and change, I think.
So 2 months. So how long do you think? Because patients always ask this kind of thing to me: is how long does it take to recover from something like this? How long do you think it took you to recover from the surgery?
So I kept reading 3 month mark. That was my magic number. I was thinking in my head. The first 2-3 weeks were a little, rough. I'd say the first 2 weeks, but then the light at the tunnel around like 2.5-3 weeks, right before I saw.
That's when you turn the corner.
Yeah, right before I saw
So
you.
that's what we usually tell people: come and see me about 4 weeks later.
Yep.
Right. So
And
you
just
don't
like
have to
that.
hear them basically miserable.
Yeah.
You just reassure them it's normal. Give it some more time. It's okay.
That's good. So for 3 weeks, it started turning around for you. That's
Yeah,
good.
3 weeks.
But the leg got away right away, but the back pain started
The
getting.
leg is usually the most disabling thing. People can deal with incisional pain, but if they get rid of that terrible leg,
And did
nerve
they-
type pain.
And did the urinary symptoms get better too?
I
right
didn't
away?
even notice any issues.
They got
anymore.
better
Yeah. Well,
immediately.
after the anesthesia, I had a little issues, but that's I think due to the
Yeah.
anesthesia. The first night, I'd say. Afterwards, it was fine.
That's good. That's
Yeah.
really good because it's not always. It's the one reason why code equine is an emergency is that if you don't get to it quick enough,
Yeah,
it can become permanent. And
That's-
that's a bad thing. That's a really bad thing.
that's where I felt I was heading.
Yeah.
In
Well, it's a
in
good
my
thing you went
hindsight.
to the emergency room and got it
Yeah.
done right away. And
It's a good thing it didn't happen in Russia.
well,
Yeah.
I'm sure they have plenty of
The-
good Russian surgeons there to do that.
Actually, back to the Russia thing. I'm just curious because you're American.
I have a U.S. passport.
and
yes.
you have U.S. passport. So and you have U.S. insurance. So did they just charge you cash? Rubles?
Unbelievably cheap. The medicine.
Unbelievably cheap.
Unbelievably cheap. Yeah, it's just cash.
How much did an epidural steroid injection cost in Russia?
I know that I got like a 3-week supply for like $80 of
Of the
meds.
medications.
Yeah, and
$80.
it's like-
Okay, that's pretty cheap.
It's like 5 or 6 cocktails of stuff. The epidural.
The price of meds in America is crazy.
Yeah,
You know,
the
I mean, some
epidurals.
patients come to me and I'm shocked sometimes that it's $1,000 for a month's supply of certain medications.
You have to go to Russia just to get the medications.
Is that
be able to
we used to have patients who were going to like Canada who were getting their meds online because
Yeah,
it was
Yeah,
cheaper.
yeah.
But I don't know if that's legal. I don't.
And they sell a lot of medications over the counter that we normally would never.
You
sell
got
over
you
the
got to be
counter.
worried about fake medication,
The quality, right?
And the quality, yeah. That's probably the biggest issue.
But so when you had the epidural, they charge you for that as well up front, or
They did, yeah. It's like a hospital visit. The epidural, it wasn't, nothing stood out. I forgot how much it was. Maybe like, same thing, like, I want to say like under $100.
so it's totally affordable there.
Yeah, it was.
Pretty cheap, but they don't do it under fluoroscopy.
Yeah.
Well, that's
Well, to be fair, I went to the institute and they said the same thing. They said that usually it's done
Under a fluoroscopy.
Yeah,
yeah,
under
that's the
X-ray.
correct way to do it.
Yeah.
so why couldn't they do it that way?
So the first place is more of like an ER I went to that they just wanted to give me the IV and then give me something, a little bit of a relief, I guess.
Right.
Yes, they probably didn't give you an epidural. I doubt it.
They gave 2 shots, yeah.
Two shots, maybe
One
like a
numbing
toradol
and then,
shot and one.
Well, I
Something
mean,
like
for the epidural, you mean?
yeah,
But it was in your back, and
it was in the back.
okay.
Yeah.
So it must have been an epidural,
was-
cortisone injection.
or maybe it was just in the muscle. Who knows?
Yeah,
Who knows where that fluid, that steroid ended up?
Yeah.
you get some systemic effect from a local injection. So
But it wasn't 100%, I remember.
yeah, I'm sure.
Yeah.
So then when did you start any physical therapy afterward, or how did you manage your recovery?
No, I've been taking it easy. I'm trying to move. Like the first 2-week period, I was trying to move. I would get tired. I'd get very tired. I think they said like, was it every 15, 30 minutes, move a little bit, and
You want to prevent
not
a
for
blood
long.
clot and problems of like immobilization.
Yeah.
Did your strength come back right away in your foot and the
Uh,
sensation?
the foot was fine. The foot was fine. It was just getting out of bed because of the muscle.
So the strength came back pretty quickly
yeah,
too, and,
yeah.
and same with the sensation. That's good.
Yeah, the sensation definitely.
Yeah, because it was numb.
Yeah, he had numbness and he had some mild weakness of the foot strength. I remember that was one of the things.
Yeah.
That's great.
Now I do a few tests every now and then when I'm laying. I lift my left foot. It's almost at 100% with my right.
Can you walk on your tippy toes?
I can, yeah.
That's pretty. That's the ultimate test.
That's the real test,
Yeah,
exactly.
if you can walk on your tippy toes after a L5S1 massive disc herniation, it's
Yeah.
pretty much 5 out of 5 strength. Plus, he's an athlete.
What kind of sports did you?
I used to run a lot, and I also play tennis, but I play two-hand touch, football, stuff like that.
Lift
back-
weights.
I did lift weights, yeah, but now I'm going to take it a little bit easy.
Probably a good idea.
Yeah,
Yeah, I mean, we generally caution patients. We've talked about this in the past, but definitely no heavy lifting for the first month after the operation. Certain exercises are actually fine to do even earlier. You can start swimming right away.
Mm-hmm.
It was in the summer, so you can start swimming. Once the wound is healed, I let patients swim immediately.
yeah.
Best thing to do is walk.
Walking.
Walking is the
Walking
best
right
thing.
away. Walking's excellent. Swimming is fine. Aerobic stuff is good. You can go back to playing tennis. Avoiding the overhead weights, I would say, is the biggest problem.
Definitely,
And if
yeah.
it hurts when you're doing something,
Don't do it.
don't do it.
Yeah.
Because you're probably
A
irritated.
few months,
Soft tissue a little bit.
it takes before you feel like you can pick up a tennis racket or whatever. But I would give it time. It's going to be now we're getting into the winter time. You have at least the winter to recover. And
the
then in the
second
spring,
kick
hopefully, you'll
coming,
be
yeah.
back to business.
Yep.
When do you let them go back to swinging a tennis racket or skiing or?
I would say skiing. I would say anywhere between 3 to 6 months. You could probably, if you're feeling
That
good.
long?
Well, if you're feeling really good,
Golf?
Golf. It's always the question in Long Island. When can I play golf? When can I drive? When can I have sex? So when can I play golf? I don't know. I mean, I say patients, you can start putting. Usually, if they really must do it. Usually around
Mini golf,
2 months.
but they don't want to do mini golf.
Then they want to go up to drivers. I'd say 3 months at least to go start playing golf. 3 months. That's what I say.
Okay.
Maybe that's a little bit conservative, but I feel like that's what's necessary because you have a twisting motion.
Yeah.
You don't want to re-herniate the
Right,
disc.
How about? I let them start bicycling.
Bicycle you can do
Walking,
very quickly because that really
running,
puts
jogging.
It takes a lot of that's not very stressful. But
Yeah.
but I certainly think swimming,
less twisting.
and walking is the best thing you can do, especially walking. Just walk, and that's the way to get exercise, aerobics, and build up your balance and things like that.
And swimming is great, like you mentioned also. I remember before, during the summer, I went to swim in the pool, and you feel the lightness, the
Yeah.
weightlessness in it.
Yeah.
It
Oh,
eases
yeah.
the pain.
Swimming is the best exercise you can do if you have a back problem.
Yeah, I think so. think
So if
so.
you have access to a pool, then this wintertime, then you should definitely go to a pool.
I might be out of it. I have a second kid coming, so maybe.
Got a baby coming next week.
Oh God!
Yeah.
Congratulations.
Thank you. So
You have a daughter or a son?
I have a daughter right now, and it's a baby boy coming.
Oh,
so.
good for you. Congratulations.
Thank
Big
you.
difference. You're going to feel like, wow, I have two basically dependents now.
Yeah.
I rely on
A
me.
big difference between boy versus girl. Or you mean big difference having one
Just
versus
having
two?
two. When you have two, you realize like, oh my God, I really have.
think- I
They are. I am responsible for these beings. You
I
know?
think the big difference is when you go from 2 to 3.
well,
I
that's
hear
a
that.
big.
I hear
you
that
go,
a lot.
You go from a man-to-man defense because you can
Oh,
you know,
that's
to a
but
zone.
Then
They
you're out.
outnumber you.
Yep.
How about 3 to
Yep.
4? You know the problem is 4. You have constantly getting cold all day long. So you're basically you got to be up with these kids talking to them about their issues, and it takes a lot of time. So with 2, I mean, right now enjoy it because they kind of like have to do what you tell them to do.
Right. Yeah.
But once they
Well,
stop doing that,
one thing parents always tell you is little kids have little problems and big kids have big problems. And when you're a young parent, you think, oh, that's such nonsense, but it's actually true.
and little kids' clothing is a lot less. Little clothes is a lot less than bigger clothes.
Yeah.
Well,
Especially,
they have less say in getting designer
Right.
things, and they wear what you tell them to wear.
that's the beauty of the whole thing at this time. So enjoy this stage.
I definitely am,
because as they
definitely
get
am.
older, they
And
make
thank
more
God you have
demands.
your back problem and leg problem is much better now.
That was in the back of my mind the whole
to
time.
now
yeah.
welcome your second child into the world.
Thank you both. Yeah.
no,
we're,
it's
we're very happy.
and you can go back now. You can go back to traveling.
Yeah. Probably like come February, March, I'm thinking about traveling.
Where are you gonna go?
Now it's with the kids, so maybe some couples trip with the other kids, our family friends.
I
We're
never, I
thinking
never
about Costa
had
Rica.
that experience.
Disney World?
I never had any. We never had any really like friends to travel with. I don't know why. We just never did. That would
I
have been
traveled
nice.
with you. We went to Philadelphia.
No, no,
together.
no. I'm talking about like going to like the Caribbean or a real trip. Where you have another family with the kids. So the kids are not bored of being with their parents. You know what I mean? It's a very nice thing and it actually I think it helps you guys relax a little more because you don't have to worry constantly about entertaining the kids. They entertain themselves.
Absolutely.
Yeah, no, Disney's good if you can afford it.
Yeah, Disney. It's pretty expensive these days, I hear.
Have yet go to Disney myself.
It's more than an epidural in Russia.
I want to go back to Disney World. Because I always love the things there that represent like the time in the 50s and 60s.
The Carousel of Progress.
Yeah, I love that stuff. Like the space, the planets. And the Magic Kingdom. That big thing.
The Hall of Presidents.
All that stuff is just fascinating, and it's just such part of history in America.
Yeah.
But I would like to go to Russia. I mean, that to me is fascinating. And the question is it safe for an American to go to Russia? I mean, that's the question. How are we treated? How would Dr. Beatty be treated in Russia?
I mean, your U.S. passport will say a lot. Like, it'll protect you in a way, but they don't really mess with you like that. But even myself, I speak Russian. They do, like, these passport checks. This is before, during the summer, like maybe 5 to 10 years ago. If I didn't have my passport, they start, like, kind of hinting.
When you're like on the street,
on the
they
street,
might just
exactly.
stop you.
Yeah, they do.
And say, hey, where are you
paperwork.
going? Where's your passport?
Exactly.
But I'm not going to like disappear if I go to Russia.
No, yeah, they're not gonna.
They don't want to do that.
They're civilized like that. They're not gonna
They're not
hold
gonna
you hostage
kidnap
or
you and
kidnap
say,
you.
I'm just like, man, not much I can do about that.
Yeah.
Although
They have to make a trade.
What about that reporter though that was held for all those years or that
They
year?
were accused of crimes. Like
spying or whatever.
Was that Brittany Griner, the basketball
Right,
player?
right,
She
yeah.
was,
but she had
marijuana or something.
marijuana. That's not a good.
That's one thing they'll probably do is like if they find
If
something,
they
they'll
find
try
something
to
illicit on you,
they'll make a
get
case
you.
out of
Yeah,
it.
don't bring marijuana. That's not a good thing.
Bad idea.
Bad idea. And don't like be outspoken against the government there when you're there.
I feel like that's what they do in their interrogation. They're
Although marijuana is legal in America for at least in New York State.
Yeah, I know.
It is,
but,
yeah.
but, but,
And
it's,
patients are constantly asking me about marijuana for
it doesn't
medicinal purposes.
it doesn't really help pain.
I think it helps uplift the mood,
I think CBD is better.
or it helps them sleep better and deal
with the sleep, right?
with the
Yeah.
sleep. He's right. It's not really a painkiller. It doesn't work the same way as the oxys or the morphines.
The
where
CBD, I think, is more
CBD has some pain relieving quality
qualities.
to
Yeah,
it. Yeah, which is not even regulated. You can get that at a.
you can get that at
gas
anywhere.
Gas station, right?
Yeah.
Do you have any? Do you take any medications now for pain? 2 months
Right
out?
now, no. I weaned off of the gabapentin maybe a month ago. So right now, there's no pain meds. Just
That's
fish
fantastic.
oil. That's about it.
Fish oil,
Yeah.
perfect. We
Good
like.
for your heart.
Yes, that is very good.
The
Oh,
omega-3s.
salmon,
Acids.
flax seeds,
I
What
gotta
else?
give it to my mom.
walnuts.
Actually. Yeah.
What else was I reading about? Chia seeds are supposed to be really healthy.
A lot of good stuff.
Yeah.
During the recovery, my mom was feeding me bone broth, a lot of soup.
Bone
like that.
broth?
Yeah.
I
Yeah,
hear that's disgusting.
people say that after there's some people believe that helps fracture healing or bone healing,
Right.
bone broth. So
Is that true?
I haven't read any
Old
studies on that.
lifestyles. Yeah.
And all, but it makes sense. Why not? And when you have a small fusion, everything helps. Calcium helps, vitamin D helps. All those things are good for healing of fractures and
Yeah.
fusions. Because really, fusion healing is really another form of fracture healing. And I'm really thrilled that you had such a great result.
I am too.
You
Thank
know?
you.
Yes,
You're-
absolutely.
You can tell all the Russians.
Yeah, we like
About
uh,
us.
Like
Yeah.
we
we like the Russian population. Yeah, they're usually pretty reasonable about their when you tell them what's going on, they accept it and they do pretty much what you tell them to do.
Yeah.
Yeah,
That's
and,
good.
And just because you had two young kids, don't hesitate to travel to Europe. I think we did trips to Israel, Paris,
Right.
London
we
with
did.
with children.
Yeah.
And
How many kids did you have?
3.
3 kids. Okay.
Yeah. So it's definitely something that they'll never forget. And it's like great memories.
Right.
You remember those things. So.
It's a good place to go south of France. The weather's great and it's
Yes.
easy.
Yeah.
That's a fun place to bring kids, and
Yeah, Nice is nice.
Nice is nice.
Very nice. But in the beginning, when they're that young, when they're newborns, little babies, then Caribbean is also good.
We
Good
were
bet.
thinking about that, yeah, or Costa
Yeah, they
Rica.
have old.
Oh,
Yeah,
Costa Rica's great.
excellent. Yeah, you stayed at the Four Seasons in Costa Rica, right? That was
That was a
fantastic
special.
trip.
That was a special trip. That was.
Yeah.
Yeah.
That was nice.
Yeah,
Well, I felt like it was safe. I didn't know much about Costa Rica.
safer than other parts of Central America for sure.
Yeah,
Right. I mean, I felt like that was a stable country, and
It's a very educated population. It's
good healthcare.
There's
Apparently,
Apparently, right?
there's no
Yeah.
wars going on there. There's no gangs
right.
that we hear of anyway. It isn't like some other places like El Salvador, other trouble spots in the Central America.
My one of our attorneys actually of our practice went to Nicaragua.
How was that?
He loved it. He thought it was amazing. I mean, it's
Yeah.
supposed to be like the next Costa Rica, but I don't know.
My PA just went. Dominic just went to El Salvador.
Well, that's probably
Did it
the
really?
safest
Yeah.
country in the world right now, right? I mean,
They've got a new president, but and he had said it was a fantastic trip. We stayed in an Airbnb right on the ocean, and
Very nice.
he said it was really amazing trip. So and beautiful, beautiful.
I feel
And
like your
not
dollar.
expensive.
Yeah, I was gonna say, I feel like your dollar can go a long way there.
Go a long way there.
Yeah.
I
Yeah.
wouldn't. That's not necessarily where I would. The first place I'd want to bring my new kids.
To El Salvador.
Yeah, I mean that's kind of an adventure trip, but yeah, I mean it's easier to travel with little kids. I
Yeah.
have to say, and then as they get older, they don't want to travel with you anymore, or they hate traveling with you. It's just not worth it sometimes,
It becomes like he said, big kids, bigger problems. So they can say no.
Yeah.
So what kind of work do you do?
I've been in the car industry my whole life. So my father has been a car dealer. He has his own car shop. He finances cars.
Oh wow, that's something you have in common.
Oh, yeah.
And that's something I'm always around cars.
So what kind of cars?
Usually it's the Uber and the TLC cars, the taxi limousine cars. They were doing it back in
Oh, I
'95.
remember now. I remember you telling me about this.
Yeah.
Very interesting. You have a real business.
Actual business, yeah. They used to do town cars back then, the
Yeah,
Lincolns,
sure.
and then they moved to hybrids with the Camrys. Now they're kind of pushing the electric cars and the handicap accessible minivans.
It's a big deal. They're using Toyota Siennas now for that.
Yeah, converted.
I love a hybrid. The hybrid is great. I mean, because I have the Toyota hybrid minivan. You need a minivan.
How
when you
many
have four kids.
miles
Yeah.
per gallon do you get on that?
It must be 35
good.
because I mean it never runs out of gas. It keeps going, and you're like, I can't believe the fuel gauge has only been this much.
It's not a plug-in hybrid.
No,
It's
but
the-
they have that technology where the brakes apparently charge.
Generated, right?
That's
yeah.
a fascinating thing to me. Like the brakes actually charge the car, enough to give you that boost.
A little boost,
electric,
yeah.
I don't know. I just haven't converted in my mind to an electric car yet.
I don't think our grid is
I'm
ready.
always afraid of like
I
running
have an electric car.
Yeah.
charge anxiety.
You have to have a charger in your house.
You have to have it in your house.
So how do you do long trips?
I don't use that car for
right.
long
Where do you
trips.
what happens if you're like
We
running
use it.
out of charge? Like I mean I know they tells you like on the screen the next charging station, but then you have to spend like a half an hour charging your car, right?
Is it half an hour?
Or I don't even know. Is that I thought it
You're
was
lucky it's
fast
half an
charge.
hour. No. The charge it takes. The home charge that I have. If I usually charge it if I'm below 50%.
Is it 220 or 120?
It's a 220, and it takes about 6 or 7 hours to get it to fully charged.
Mm-hmm.
So yeah, nothing is half an hour. I mean, they have these superchargers,
right.
which can charge faster.
But they're not always available.
Not always available, and Tesla has them. They're harder to find, and yeah, I think the average charge you have in your house is it's going to take hours to charge.
Right.
You charge it overnight while you're not and it's cheaper electricity at that point, so it's more economical to do that anyway.
Mm.
But yeah, electric cars I think they're here to stay.
Oh yeah.
They're here to stay, and the technology's getting better. I mean, Porsche is making a lot of electric cars now. I think
Mercedes has them, and
Corvette has an electric
all
car.
these fancy
They,
cars.
they have this one brand, Fixer. I don't know if you've seen Ocean.
Yeah, I know. What
It's
that is.
bankrupt though, but it's super cheap. It's amazing how cheap those cars are. It's like something like 12 or 18,000 for like a 2022.
Wow.
But the problem with those used cars, the used electric cars, is that it's old technology, and I'd rather get a used gas car
Yeah,
than a used electric
Absolutely. Yep.
because you don't know how that battery life is going to last, and what happens to that battery.
Yeah.
How long does the
And
battery
batteries-
last before
That's
you have to replace the
that
battery?
we don't really know. you know, and they lose their effectiveness after they get old.
Yeah.
So
the
are you
older
back
they
to
get.
are you back to
get.
work in your business and everything like
I
that?
was back to work, yeah, within I think 2 weeks.
Oh, great.
Very little, just to go in, sit down, and then basically go back home. You know, I
Sure.
was
Yeah.
being driven. You know.
That's good. So for patients, watching our podcast, here is a person who went through surgery in the back and they were back to kind of business in a few weeks. That's very good to know.
Yeah, absolutely.
That's ideal.
And I'm looking forward to every day. Everyone always asks me, "How's the back doing?" And then I tell them I forget that I had an issue. You know,
That's good.
We want you to forget it. That's
Yeah.
it. Go on with
You
your
don't want
life.
to, you don't
and-
want to, that's a successful operation.
Yeah.
That you don't have to think about it.
Yeah.
You know, and you're gonna have, your hands full in a week or two with this new baby boy. Good luck to you.
Thank you. Thank
Just
you very much.
be careful how you hold them. and
Absolutely, yeah.
Keep your
He's,
back. Always keep your back straight.
I have like a little stabilizer.
support.
Yeah, I'm definitely going to use that.
But a newborn's pretty light.
Like what?
You'll enjoy it.
7 to 10 pounds.
Yeah.
You'll be okay with that.
Hopefully, it's not more than 9 pounds. That's a big baby.
You'll be
I was
you'll be good with that.
I was around 8.5, 9 pounds.
You're a big boy
Yeah.
too. How much did you weigh?
7-Eleven.
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 Yep.
I was in kilos, so about 3.5 kilos, which I don't know what that converts to.
That's
7-ish.
That's
7, 8?
Yeah.
yeah. I think that's about right.
Yeah.
Well, it has been a pleasure having you here.
Thank you very much for having
You
me.
came in a really nasty weather outside. We have like a nor'easter
I know.
going there.
It
It
would,
really feels like fall now, you know?
I was thinking it's like it feels weird. Like it was warm in the morning, and then it kind of gave me ideas that it's like spring already, and then we're gonna go straight to fall right now.
Today is a very important day. It's my son's 25th birthday today, my oldest son.
Happy birthday
that's
to
a
him.
quarter of a century.
Yeah, I'm very.
Awesome stuff. So you're going to take him out
So
to dinner?
shout out to Beck today, actually 25 years.
So what are you
Beck is
planning?
going out with his friends tonight. We will be lucky to celebrate tomorrow. But
Yeah,
still.
that's how it
So
is.
tomorrow night you're going to go out. For
Well,
a
hopefully
festive
I'll see him
meal.
today before. We're supposed to
All
go
right.
out for maybe something, but I don't know. Now it looks like the plans, but that's the way it is, and I accept it now at this point. So anyway.
Enjoy them while they're young.
Yes,
While you have
Absolutely, yeah.
control over them.
I take the photos and the videos. I keep a
Yep,
memory of it.
keep those things
Yeah.
around. One night you'll review them when many years down the line, you're like, I can't believe it.
Yep.
It goes by fast.
That's the way I hear and I see it too.
It goes by fast.
Yeah.
You're like you blink an eye and you're like, I can't believe he's 25 years old already.
And your kids are older than that. You have Adam is even older.
28.
That's
Yeah.
crazy.
Yeah.
Yeah. So it goes by quick. It goes by quick.
28 is your oldest.
He's the oldest.
Yeah.
He's 28. Yeah. So
Well,
it'll go by, and it feels like yesterday he was just a little baby. So
Yeah.
it goes by very fast. It goes by very fast. So enjoy every minute.
enjoy every minute. Enjoy Spine Row mug, and we're just very pleased of how you did, and that's why we wanted you to come on and talk about your experience. And we're so happy that you had a great experience.
And I'm likewise.
Thank
Thank you very much.
Yeah,
It's our pleasure.
You guys
All
have a
right.
great team. Thank you.
Great.